Hi, my name's David Lam and I'm a rural GP in Port Lincoln, South Australia and the 2019 RACGP National GP of the Year. I'm the Rural Medicine Coordinator at the University of Adelaide School of Medicine, a role in which I am in charge of delivering weekly teaching to all 42 medical students at the university placed in rural South Australia. I'm also an accredited GP Registrar Supervisor and a Medical Education Officer at the South Australian Regional Training Organisation GPEX. I am passionate about educating, supervising, and supporting all general practitioners in training because I truly believe that the key to ending the rural health workforce shortage that has plagued Australia lies in teaching, mentoring, and encouraging GPs in training to the best of our abilities. It is for this reason that I've accepted the nomination for the RACGP SA&NT Council. I am personally the first ever medical student to be placed in Port Lincoln, situated 650 kilometres away from the nearest major hospital, to then return as a GP registrar and then to remain in the region serving the community post-fellowship. In this time, I've seen it all. I have seen rural registrars crippled by the fear that they will fail their fellowship exams, but without the time to study due to the unpredictability of looking after both their clinic and rural hospitals simultaneously. I've seen them miss out on sit-down, dedicated teaching time from supervisors who unfortunately suffer the same unpredictability of their rural clinical duties. I've seen registrars fail their exams, get discouraged, and leave rural areas forever. I've witnessed the attrition of a workforce of seasoned and skilled rural GPs. I've seen them move to the cities as they approach retirement age or to cater for the schooling needs of their children, and there being no one to take their places. I've sadly witnessed remote communities begging for sustained quality healthcare in the midst of this erosion of the rural workforce. I've seen things get so much worse due to social distancing and restrictions on medical education in the midst of the COVID pandemic. On the other hand, I've seen registrars, such as myself, who have been properly supported by dedicated supervisors, who deliver the best quality supervision and protected teaching, irrespective of whatever else is going on in the world. I've been fortunate enough to have supervisors who made me the priority as a GP in training. I like to think I have become such a supervisor myself, as evident in the fact that myself and my two recently fellowed registrars are the only three amongst many candidates for years now to have passed exams and stayed in Port Lincoln. If elected to the council, I will strive to ensure that the educational and supervision needs of all rural registrars are met. I will use my almost 10 years of experience as a clinical tutor and university lecturer to plan and create content for the best quality educational events, sessions, and resources. I also plan to use my creativity and use of technology to conquer the tyranny of distance that often prevents rural GPs and GPs in training from accessing the same educational support and events as registrars in metropolitan areas. A prime example of this is the educational podcast for GPs in training called GP Life Hacks, which I created to counter the restrictions of the COVID pandemic. It consists of 20-minute audio tutorials with supplementary online pictorial flashcards, the perfect size and format for the busy rural clinician who is hard to pin down for great lengths of time given the demands of their job. I will also aim to use my involvement in both the medical school and the regional training organisation to create a clear and enticing pathway for medical students to become GPs in training and then fully confident and effective fellows of the Royal Australian College of General Practitioners. I see this as the key to ending the rural doctor workforce shortage in Australia. As a member of the council, I also seek to contribute to the upskilling of GPs and GPs in training practicing in mental health care across the country. I strongly believe that good mental health care and psychotherapy conducted by GPs is vital to improving outcomes across the nation, as the prognosis for mental health requiring hospitalisation is much poorer than if managed earlier in a primary care setting. I currently serve as a member of the General Practitioner Advisory Group of the Black Dog Institute, which helps steer the clinical focus and practical application of the Institute's nationwide mental health research. I also facilitated the establishment of the psychotherapy clinic Wellness SA in Port Lincoln. I hope to use all of these skills and experience to serve the council and better the profession. Thank you for your support.